First aid to disaster victims. The main objective of first aid is prevention of death, preventing deterioration of health and starting the process of rehabilitation, that is resettlement of the affected people. Hence, it is important to know about the emergency measures or first aid practices to be followed. The basic principles of first aid are: first of all, you have to understand life and resuscitation. In short, we can abbreviate as ABC, that is airway, breathing and circulation method. Now the first one, airway. If the victim has difficulty in breathing, the head should be held in a backward sloping position or the chin should be raised so that the respiratory passage remains open. Second, breathing. If breathing has stopped, the victim should be given artificial ventilation by mouth to mouth resuscitation. Third, circulation. If the victim is unconscious, then after giving mouth to mouth respiration twice, the heart should be pressed down hard by pressing the chest with both the palms. These two actions should be repeated alternately about 15 times. This is called cardiopulmonary resuscitation, that is CPR. It helps to bring the circulation back to normal. First aid given for the other injuries. Bleeding. If the victim is injured and bleeding through the wound, then the wound should be covered with an antiseptic pad and pressure should be applied on it for 5 minutes with either thumb or palm. Fracture and impact on vertebrae. If any bone is fractured, it is essential that the fractured part be immobilized. Okay, that is, no movement should be made. It can be done with the help of any available wooden rod, batons or rulers. If there is an impact on the back or vertebral column, the patient should be kept immobile on a firm stretcher. Burns. If victims have burn injuries, it is beneficial to hold the injured part under clean and cold flowing water for at least 10 minutes. For injuries like sprains, twisting and contusion, the rice remedy should be applied. Now the meaning of contusion is a bruise, that is ruptured skin or injured tissue. Now rice remedy means rest, ice, compression and elevate. Rest. To allow the victim to sit in a relaxed position. Ice. Apply an ice pack to the injured part. Compression. After the ice pack treatment, the injured part should be massaged gently. Elevate. The injured part should be kept in a raised or elevated position. Now, you have to understand how to transport the victims or patients, or how to take care while using the methods of transporting the patients. Following care should be taken while using the methods of transporting patients. The first method is cradle method. This method is useful for children and underweight victims. Second, carrying piggyback. It is useful for carrying patients who are unconscious. Third, human crutch method. If one of the legs of the victim is injured, the victim should be supported with minimum load on the other leg. Fourth, pulling or lifting method. This method is used for carrying an unconscious patient through a short distance. Fifth, carrying on four-hand chair. When the victim needs support below the waist, this method is useful. Sixth, carrying on two-hand chair. It is useful for those patients who cannot use their hands but can hold their body upright. The seventh method is use of a stretcher. In an emergency, if a conventional stretcher is not available, then a temporary stretcher can be made using bamboos, blankets, etc. to carry the victim. Other emergency measures. Boats are used by the civil administration to rescue people trapped in a flooded area. As an emergency measure, wooden boats, bamboo floats, air-filled rubber tube from a tire can be used to advantage. A fire extinguisher is a portable appliance that can be easily carried anywhere. Various appliances are used to put out a fire. Concept map. In this chapter, we have understood environmental management related to weather or climate, solid waste and disaster. In the topic weather and climate, we have understood the various factors which affect the weather and climate, then how weather and climate influences the biotic and abiotic factors of the environment, then how the weather and climate is predicted by the meteorological department by various types of models. The various types of models used for weather forecast are monsoon model, mathematical model, holistic model and statistical model. Then we have studied classification of solid waste depending on sources and nature of waste. Depending on sources, they were classified as domestic, industrial, hazardous, farm or garden waste, electronic waste, biomedical waste, urban waste, radioactive waste and mining waste. Depending on the nature of waste, they were the two types, biodegradable and non-biodegradable waste. The solid waste management, then we have studied disaster management. Then we have studied the methods of solid waste management and disaster management.